Hello everyone, this is Dr. Huma Ibrar. Welcome to my channel and have a good day to my YouTube family. So today's topic is going to be much more informative than any other videos, previous videos. So today we will cover MCQs of last DHA exam which were shared by one of my brilliant client, Dr. Nada Thakur. I would like to appreciate her a lot for clearing DHA exam in first attempt. Congratulations, dear, and wish you best of luck for future. Plus, I'm so excited and so grateful that people like you still exist. And she has shared MCQs that were mentioned in recent DHA exams so that our YouTube family members could easily clear and easily prepare for it. So that they can clear the license exam in first attempt. You all can see mail by Dr. Nada in your screens. This already shows that exam material I shared with you all is more than enough to clear any exam of Middle East in first attempt. Next is all up to you and your dedications towards your preparation. So those who are asking about Prometric material, that will it be enough to clear exam, or in these files which files are most important, or some of my clients keep asking about how should they prepare for it, or that could I give them sessions of it, and could I share more MCQs of exam with them. So like many other clients, Nada has also cleared DHA exam from the exam material that I shared with her dedications toward preparation. So it's all up to you guys. You have to struggle for it and listen carefully that only gathering data, gathering Prometric data from everyone and from each site, from websites, from Facebook, from Insta, wouldn't help you to clear your exam. Instead, keep your material precise and stop scattering your knowledge by gathering data from each side. That is of no use. Okay everyone, let's start. The first one was about Q angle. You should know about Q angle. And the second one was burst fracture. Burst fracture is basically fracture of spine. Okay, then was how to palpate subscapularis tendon. Sorry for my handwriting. Okay, then the subscapularis. The fourth one was about subscapularis. I will repeat that these were MCQs from recent DHA exam. Muscle length, subscapularis, muscle length, strength length. Okay, then coxa. There was coxa vara picture, coxa vara photo or picture. Then there was about geno valgum. Then there was question about deltoid muscle. I think these were some pictures that were shared and you would have to guess that one. Okay, that after that there was question about deltoid muscle nerve supply. You should clear all of these. Then there was pelvic band prosthesis name. And that was picture. That was above knee orthosis. Okay, then come towards the 10th one, prone kneeling picture. There was prone kneeling picture. You have to guess about that picture. Okay, then question from tennis elbow. That is lateral epicondylitis. Okay, cubitus valgus. Which fracture? Cubitus valgus. Which fracture? Then there was about maximum ultrasound intensity. Maximum ultrasound intensity was from electrotherapy. Okay, then move towards next. About there was question about to reduce adherence after laminectomy, which modality is used? To reduce adherence after laminectomy. Which modality is used? Okay, then the question was about to chemical to mechanical energy, and that is chemical to mechanical energy. I'm sharing as it is skeletal muscle. Okay, then come towards ligament special tests. There were ligament special tests. Distraction with medial and lateral rotation. Then there was indirect effect of heat. Muscle relaxation. Indirect effect of heat. And the correct option was muscle relaxation. Okay, the next one was Moro reflex. These are all discussed in my pocketbook also. Moro reflex. Then it is tonic labyrinthine reflex. Okay, it's also discussed in my pocketbook. Then there was plane and axis of abduction adduction. As I've already told you that axis and planes of abduction adduction. Okay, plan and axis of shoulder flexion. You should know each and every plan and axis. Shoulder flexion. Then there was about lateral and axis and plan of lateral and medial rotation. Okay, let's move towards next. That was plan that divides body in cranial and causal part. Okay, then hot tubs. Hot tub is contraindicated in and the option was MS, multiple sclerosis. Okay, then modifiable risk factors of stroke. Then there was a question about median nerve injury. After then, falling an outstretched hand, increased pain on wrist flexion and lateral wrist pain. Okay, please note that falling on outstretched hand, increased pain on wrist flexion and lateral wrist pain. Okay, then there was about I'm so tired of writing these lengthy MCQs. So note that after that, pain on Like medial nerve injury or avascular necrosis of scaphoid. Then there was a question about flexion of elbow in neutral position of elbow. Flexion of elbow in neutral position of elbow, that was brachioradialis. Then comes bicep brachii jerk, quadricep jerk nerve root, S1 dermatome diagram. There was S1 dermatome diagram. Then there was red flag sign for acute low back, red flag sign for acute low back pain. And then there was grade of sprain. You should know the grade of sprain, grades of sprain. Then okay, resisted isometric grade, resisted isometric grade. Okay, let's move towards next. That is question on axontomesis. I have discussed it in my pocket book. Axontomesis, question on axontomesis, on neuropraxia. These are all discussed in my pocket book. Neuropraxia, neurotmesis. Okay, then comes dystopia definition. Dystopia definition. Then hemiplegia definition. Hemiplegia definition. Then there was question about Parkinson symptoms. Parkinson symptoms. Superficial heat modalities. Superficial heat modalities. Okay. Then there was question about lead pipe rigidity. Lead pipe. It's also discussed in pocket book. Rigidity. Okay. Then PNF for stroke. PNF for stroke. Okay, then rhythmic initiation definition. These are all described in my pocket book. Rhythmic initiation definition, and then rhythmic stabilization definition. How to decrease symptoms of piriformis syndrome. Symptoms of piriformis syndrome. How to decrease symptoms of piriformis syndrome, and the option was stretching, in adduction, stretching in adduction, and rotation. Okay, how to decrease symptoms of piriformis syndrome. Then there was question about springy end feel in knee, ligament injury, meniscus injury, sprain. Okay, springy end feel in knee. Then there was neuropraxia. Which modalities are used in neuropraxia? Phrenic, interrupted direct current, tense EMS, below knee amputation, excessive knee flexion reason. Okay, below knee amputation, what's the reason for excessive knee flexion? Okay, then there was question about biostatics. One question from biostatics. Excessive pronation in foot causes what changes in pelvis, knee, and hip? I will repeat. Excessive pronation in foot causes what changes in pelvis, knee, and hip? Then there was question from laser used to treat cancer. Fall on lateral. Then after that, fall on lateral shoulder under to perform elbow flexion. Which nerve involved? Fall on lateral shoulder. Okay, under to perform elbow flexion and supination. Which nerve is involved? So that was musculocutaneous nerve. After UVR, pigmentation due to melanin. After UVR, pigmentation is due to melanin. BMI of overweight. BMI of overweight. You should know about all BMI ratios. Then definition of endurance, definition of coordination, refining and organ function. Okay, RUFFINI, refining and organ function. You can see this. This was asked, and after that, lingula, drainage, position. I will repeat each after this. After completing this, I will repeat. PD contraindication. PD contraindicated in cor pulmonale. Not sure. She wasn't sure about answer. Absence of P wave. Absence of P wave is in. Absence of P wave is in atrial fibrillation. This is from cardiopulmonary fibrillation. Okay, then there was question about absence of hydrocollateral temperature. Hydrocollateral temperature. You should know about temperature of hydrocollateral. Okay, then pelvic floor muscle, levator ani. Levator ani is pelvic floor muscle. Then diastasis recti. Diastasis recti. Diastasis recti centimeter. Learn about it. Diastasis recti centimeter. Then scale to measure spasticity in pediatrics. What's the scale to measure spasticity in pediatrics? Spasticity scale. Okay, that was BOG. In pediatrics, how to measure spasticity in pediatrics. BOG, Berg, balance, motor development, and modified Ashworth scale. And she selected, these were the option: BOG, second one was Berg balance, third option was motor development, and fourth option was Ashworth scale. Okay, Ashworth scale, and she selected modified Ashworth scale. Option D, she selected modified Ashworth scale. So these were some MCQs she shared with me. I will repeat each MCQs after this. Okay, listen to me carefully. This was difficult to write each MCQs and then discuss with you all, and also holding my mobile phone. So sorry for that bad handwriting. So the first question was about Q angle, then burst fracture. What is burst fracture? And then the question was how to palpate subscapularis tendon, subscapularis muscle strength, and then was subscapularis strength position, coxa vara picture, coxa valgum, deltoid muscle nerve supply, pelvic band prosthesis name. Okay, that was picture, and the option was above knee prosthesis. And then there was a prone kneeling photo, and tennis elbow, cubitus valgus with fracture. Which fracture? And that was lateral epicondylitis fracture. Cubitus valgus, which fracture? Lateral epicondylitis was option. Maximum ultrasound intensity 1.5 megahertz. And to reduce adherence after laminectomy, which modality is used? She selected ultrasound. Chemical to mechanical energy, skeletal muscle option. Ligament special test, distraction with medial and lateral rotation, indirect effect of heat, muscle relaxation, Moro reflex, tonic labyrinthine reflex, plane and axis of abduction and adduction, plane and axis of medial and lateral rotation, plane and axis of medial shoulder flexion, plane that divides body into cranial and caudal part. And that was I think I spoke first casual. That was not casual. She wrote casual, but that was, I think, caudal. Hot tubs contraindicated in musculoskeleton. Hot tubs contraindicated in multiple sclerosis. Modified risk factors of stroke, median nerve injury. Median nerve injury and falling on outstretched hand, increased pain on wrist flexion and lateral wrist pain, and median nerve injury or avascular of scaphoid. Okay. Flexion of elbow in neutral position of elbow, that was brachioradialis, bicep brachii jerk, quadricep jerk nerve root, S1 dermatome diagram, red flag sign for acute low back pain. And that was options were pain, loss of reflexes, spinal signs. You should know grade of sprain. Okay, then resisted isometric grade, question on axontomesis, neuroplexia, neurotmesis, dystopia definition, hemiplegia definition, Parkinson's symptoms, rigidity and tremors, superficial heating modalities list, and lead pipe rigidity, PNF for stroke, rhythmic stabilization definition, rhythmic initiation definition, how to decrease symptoms of piriformis syndrome, stretching in abduction and rotation, springly and feel in knee ligament injury, ptosis definition, neuroplexia, which modalities are used, below knee amputation, excessive knee flexion reason, biostasis, one question, excessive pronation in foot causes what changes in pelvis and knee and hip, laser used to treat cancer cells, fall on lateral shoulder under to perform elbow flexion and supination, which nerve is involved, and the option was musculocutaneous nerve. After UVR, pigmentation due to melanin after UVR, pigmentation due to melanin. UVR, okay. BMI overweight, definition of endurance, definition of coordination, Symphony and organ syndrome, and angular drainage position, PD contraindicated in cor pulmonale, absence of P wave, atrial fibrillation. Okay, then hydrocollateral temperature, pelvic floor muscle levator ani, diastasis recti centimeter, scale to measure spasticity in pediatrics, Berg balance, motor development, and modified Ashworth scale. That was last question of her, that she selected Ashworth scale. So this was all for today. That was the MCQs from DHA exam, recent DHA exam. I will again thank you, Dr. Nada, and wish you all best of luck.